So Jadin and I will be talking about a client who is a 68-year-old woman and is an avid golfer and has asked for a home-based exercise prescription. The client has addressed her concerns of her balance and proprioception, specifically when navigating stairs and playing golf. She has noticed that her left side appears to be weaker than her right side during ambulation and a decrease in grip strength. As exercise professional, she has asked us to develop a home-based exercise program that will focus on improving her balance, strength, and ambulation to decrease her fall risk and to help her feel confident in golfing again. Decreasing her fall risk is important as CDC suggests that 1 in every 4 older adults will fall every year. The Burk Balance Scale will assess the client's balance through 14 predetermined tasks. Each task will be demonstrated and explained prior to the client's performance and will be rated on a 5-point scale. Then the client will be instructed on how to perform the specific task, with 0 indicating the lowest level of function and 4 the highest level of function. The highest score is 56 points, while a score of 41 to 56 indicates a low fall risk. 21 to 40, medium fall risk, and 0 to 20, the client is at a high risk for falls. Next, the tug test will also be demonstrated and explained before the client's assessment. This test will assess the client's balance, power, agility, and fall risk. It has shown to have 87% sensitivity and 87% specificity when assessing fall risk in older adults, according to Thine Wong 2020. The client will start in a seated position, and then when told go, the time will start and they will stand up and walk 3 meters and turn around the cone and walk back to sit in the chair, and the time stops when the client is fully seated in the chair. We will repeat the protocol so that the client is turning around at the cone with the other foot as the inside foot. According to CDC, an older adult who takes greater than 12 seconds to complete this task is at high risk for falling. Hand grip strength will also be assessed using a handheld dynamometer. The client will be in a seated position with an upright posture and instructed to squeeze the handheld device as strong as they can 3 times, and the average score will be determined. Both the right and left hands will be assessed. These assessments will assess the client's overall functionality within various fitness and neuromotor domains, muscle strength, power, balance, gait, and agility. Additionally, the pre-assessments chosen will allow us to observe and determine her functionality within activities of daily living.
In the next few slides, we will talk about the evidence that we found to support our exercise prescription. We will discuss each article and the exercise that we chose to include in our client's home-based exercise prescription. As evidenced by Narita et al., the exercises and progressions shown here may improve balance. 12 older women underwent a 12-week exercise intervention that included single-leg stance, walking, and head rotation, along with the corresponding progressions shown here. After the intervention, improvements were seen in dynamic balance, movement velocity, directional control, and tug test time when compared with the 12 older women in the control group. As evidenced by Emma et al., calf raises may also aid in balance improvements. In this study, 17 older men performed 8 weeks of calf raises at home 3 times per week. After the program, the intervention group did not show significant increases in static balance performance, but did show increases in medial gastrocnemius and soleus activation during performance compared to the 17 members of the control group, suggesting an increased neuromuscular adaptations and may lead to improved balance performance. Calf raises were also used by LaCroix et al. And Gavin et al. LaCroix et al. Had 66 participants equally assigned to twice supervised training with once-week unsupervised training, 3 days per week of unsupervised training, or a control group. After participating in a 12-week balance and strength training intervention, the supervised group showed increases in static, dynamic, and proactive balance measurements, and the unsupervised group showed improvements in the proactive balance measurements, suggesting that the combination of balance and strength training exercises may promote balance improvements. Gavin et al. Had 8 older participants complete a 16-week resistance and stretching program. Following the intervention, researchers noted that the leg press, and calf raise exercises increased hip and ankle strength, allowing for better stair descent navigation. By progressing the calf raise exercises to calf raises with no chair, we will limit the base of support of our client, further promoting neural adaptation and increasing the need for good balance. The squat was also used by both Gavin et al. And LaCroix et al. In the same studies mentioned previously. We believe that the squat is a useful exercise because studies such as those conducted by Zarai et al. And Wilson et al. Have shown that hip extensor strength and hip abductor strength have significant relationship with static and dynamic balance as well as fall risk. By adding a resistance band, we will increase the need for hip abductor strength, further driving strength adaptation.
Hip abductor strength will further be targeted through sideways walking. This exercise was used by Narita et al. As well as Lee Ambrose et al. In this study, 172 elderly adults participated in a 12-month balance and strength training intervention to determine if the training intervention would help prevent falls in an older population. After the intervention, fall rates were lower for the intervention group, as it was 1.4 falls per person per year compared to the 172 participants in the control group, which had 2.1 falls per person per year, suggesting that the exercises such as sideways walking may decrease fall risk in elderly populations.
As previously mentioned through the previous slides and numerous credible sources used to design this home-based exercise program, we also decided that the client will be expected to complete the exercises 3 days per week for 30-minute sessions, as recommended by NSCA and ACSM. The sets and reps were determined from what was used within the studies and were in accordance with ACSM and NCSA recommendations. Included in the exercise prescription are a variety of exercises that were represented and supported on the slides prior. The program is focused on developing the client's strength and neuromotor ability. Utilizing recommendations from various credible sources, we believe that this client will be back to golfing confidently with increased balance and will have a significantly reduced fall risk and can have even greater confidence in activities of daily living.